Hello and welcome to our new format for electronic newsletters. As an introduction to what we intend to communicate, let me first read something from the latest edition of Inside Dentistry, an article titled Integrating Oral and Medical Health Care. A growing body of evidence suggests an association between oral and systemic health, particularly in terms of the impact of periodontal disease on chronic illnesses, including diabetes and cardiovascular disease and pregnancy outcomes. Eliminating the artificial separation of doctor and dentist is a first step. It is clear the traditional model of separating the mouth from the rest of the body isn't working. It just doesn't make sense. It's always been a basic idea of natural dentistry that the whole body must be understood as a working system. And as a health professional, we're facilitators to help remove barriers to the body's overall proper functioning. As a guide for a new health alignment, we came up with a health formula. It is a guide that helps both patients and doctors alike. Each component part is necessary to achieve the result. Structure plus nutrition minus toxicity equals physical health. A body with good physical structure facilitates motion, and food with high nutritional content supplies energy, and the elimination of anything toxic to the body relieves internal stress. Altogether, they really do lead to health. Each part of this formula deserves attention. So we're bringing you video interviews of other health professionals from different disciplines. Each will shed light on the formula and how their knowledge and expertise advances the cause of health. We hope you find this as interesting as we do.
Our first interview is Pamela Moore, certified in nutrition and naturopathy. She is a pioneer in the use of live blood analysis to see the current condition of the body, how it is being affected internally and externally by its environment. In the health formula, this information addresses both nutrition and toxicity.
When live blood was introduced to me 20 years ago, and I took the training, I realized that I didn't know anything, and I couldn't stand that. So I made it a quest for the last 20 years to be trained by as many people as I possibly could get to validate the efficacy of live blood. But live blood today is being used in health food stores. It's being used, and people are making comments that are totally incorrect. And this is where the medical community gets livid, and people are making statements that are not correct. My goal as a practitioner, and having done it for 20 years, I've clinically documented the efficacy of this work, period. And it actually, when I make a statement, it's not out of I pulled it out of a hat, but it's because I've clinically documented that it is what I'm looking at. The microscope is a life-saving gift and tool, and if it's used correctly, it can make a difference in anybody's life. And it's not the end-all to what we do. It's a piece of the puzzle. When we do look at live blood, we're looking at the actual events that are taking place as far as how a person is utilizing their nutrients, whether they're getting good oxygen exchange. We look at how functional the white blood cells are. We look at what we call the plasma that they're suspended in, but that's called the physical terrain, how that reflects their immediate internal environment. We can look at how their immune response is. I can look at somebody's blood and I'll see a green tint on something, and I'll see a white blood cell that's called a monocyte. And then I'll see, in an hour or two, I'll see chondrites, which look like little strings that move very fast, depending on how long they are, how fast they move. We call it high valence. Those are all markers, and they're markers that I had to identify clinically because I didn't know what they were. And when I looked at those markers, I had read in a book that they were viral markers, that you would want to check for that. Well, that was in the book. I didn't know that. So I started clinically testing patients that would have these viral markers, and I would send them from my office straight to a doctor, and I would request a hepatitis panel, maybe an AIDS panel, depending on their lifestyle. I would have them do a mono and an Epstein-Barr panel. And every single time those markers were excessive in live blood, it would come back. One of those markers actually had a name to it. I've identified hepatitis C, hepatitis A, hepatitis B. Also, these were people that were under care of other doctors who were treating things as the flu. They had no clue and had not done those tests. And the only reason I knew to do it was because of the markers I found in live blood. That's the value of it. That I have clients that are alive today because I learned how to look at live blood markers that are indicative of congested blood supply, which means that there's too much fibrin, it cuts off oxygen supply, it can cause many clots, it can create distress on the heart, it can cause congestion with the way the heart functions. And because of my markers, I've been able to send someone directly from my office straight to the emergency room. And someone actually had to have 3 stents put in because they had 80% blockage. I didn't know that, but I saw the evidence of the congestion that was happening, and I knew I couldn't work fast enough to make a difference. That's the other thing about live blood. It helps us to see where just recently I had a man come in, and he was violently sick. And he was what I call a typical man, and didn't want to go to the doctor, and his wife brought him here, and I said, you need to go to the hospital. I said, there's something radically going on, because his blood, live blood, was very congested. I had to do it 3 times, and I couldn't get the cells to separate. There was no oxygen. He was in trouble. And I said, you need to go to the emergency room. And he was describing his complaints. And I said, well, I don't know, but maybe you have an aneurysm, maybe you're throwing a clot, maybe you're going into kidney failure, but there's something radically wrong here that we need medical attention. He ended up going, and he had a bleeding aneurysm. He had 80% blockage of his only kidney, to the artery to the kidney, and he had a violent infection of a diverticuli pocket. Now, all I saw were the markers of radical distress. Now, if he'd have gone someplace and they'd have gone in and said, oh, well, you've got the flu. He's had diarrhea, he was throwing up, he looked horrible. But because of my work that I did, instantly, within 3 minutes of sticking his finger, I knew he was in trouble. Bad trouble that I couldn't work fast enough, and I wasn't going to jeopardize his life. That's what this work can do. When I received the first opportunity to look at live blood, I was so overwhelmed. I wanted everybody I knew to have it done because it was real. It was a real interaction to them, their life. It was their blood. It was what was going on in their life. And I can't tell you how many people have come to me and have cried in the fact that they said, my God, no one believes me. They say it's all in my head. And I look at their physical terrain and I show them a picture. This is what healthy blood looks like. And this is what your blood terrain looks like. And even uneducated people can compare the two. And it validates that they're not crazy. It validates that it's not in their head. It validates that they really do have physical challenges. And the exciting thing about that is they can take control now of their health. They're now validated that there's something wrong. Now, what do I do to fix it? Well, I've learned as a practitioner how to take and look at their compromised terrain, and I know what to do to make it better and get them in a better state of health. And they then have hope. They now have a way that they can take control by me educating them and them then following what I recommend and applying it. And the end result is they come back and they get to see the actual, their blood changed in 30 days, which equates to them feeling better. And now they get excited. They're ready to take it another 30 days and continue to progress in their health so that they get better. I get to see that kind of reversal of people's chronic illnesses that have worked between 8 and 25 years of distress, and they come in here and I look at their terrain and I say, oh my word, you know, what's exciting about this is that I know how to make it better. I'm not going to guarantee that we can correct all your diseases that have a name, but I guarantee you that whatever that disease is, it will either get better or go away. Live blood is a reality check. It's real time of how the body is being affected internally and externally by its environment. Things that we're exposed to, things that we put on our skin, it's all reflected in the analysis of live blood. And it's the piece that's missing. And I personally feel that if every doctor on the face of the earth, regardless of their degree or education, if this was done first, within 3 minutes, 10 minutes, 24 hours later, they would be able to actually make an excellent assessment quickly that could save a life and make a difference and know what direction to go into before they ever do a test. We live in a world today that, there's a big political challenge for all of us in the alternative health field. But my goal is to take what I've learned and share it with those who truly, truly, truly want the best tools in their toolbox to help people regain their health as fast as possible. The reason I feel so compelled for this is because the patients that I get are everyone else's patients that have been on their journey between, as I said earlier, 8 to 25 years, spending thousands of dollars in health care, alternative and medicine, and they're still sick. And when I get to see them, I get to see what wasn't done, and it's absolutely across the board. It is foundational health. Everybody works outside the box. They try to put the roof and the sides on before cleaning the filthy environment. And you're never going to make a dent, even though people get better and they do somewhat well, but there are those who never get well. And it's the same foundational dysfunction that I find. It's just the severity. And so I started looking at that and I thought, my God, I have the same training that they all have. So why do I want to continue to treat the same way? So I had to do the moonwalk backwards and figure out how in the world to reverse that process and help these people. So I started working the opposite way. And that opposite way has become my foundational health, to take these people that have been ill for all these years, and within 3 to 4 months to 6 months at the most, they are back on their feet, they are back in their life. And are they completely well at that point? Not necessarily, but they are now doing things they thought they would never do in their life.